Heather, and I'm one of the pharmacists here at Primary Plus, and we have this video today to tell you about your Symbicort Inhaler, and we'll also go over how to use it and how to clean it. Your Symbicort Inhaler can treat COPD or asthma, and it actually has two different drugs in it that will work together to control the constriction and inflammation that you might have in your airway. But Symbicort's not a rescue inhaler, and you should not use it if you have a sudden onset of symptoms. You should have a separate rescue inhaler handy at all times in case that were to happen. Your Symbicort should actually be used 2 puffs twice a day, every day, preferably about 12 hours apart. If you were to miss a dose, do it as soon as you remember. But if it's an extended amount of time before you remember, go ahead and just resume your normal dosing schedule because we don't want you to do more than 4 puffs within 24 hours. When you get your inhaler home, it's going to be in a sealed box, and it's actually going to be in a foil container inside of here. It's important that you keep it inside this foil container and in the box until you're ready to use it, and keep it in a cool, dry place. First, you will need to prime your inhaler. Hold the inhaler in an upright position and shake it well for 5 seconds. Remove the mouthpiece cover by squeezing both sides, then pulling out. Hold the inhaler facing away from you and release a test spray. Do this when you open a new inhaler, if you don't use your inhaler for more than 7 days, or if you drop it. Now your inhaler is ready to use. Shake the inhaler for 5 seconds and again remove the mouthpiece by squeezing both sides. Check the mouthpiece for foreign objects. Breathe out fully. Hold the inhaler up to your mouth and place the white mouthpiece fully in your mouth, closing your lips around it. Make sure the inhaler is upright and the mouthpiece is pointing towards the back of your throat. Breathe in deeply and slowly through your mouth while pressing down firmly and fully on the top of the inhaler to release the medicine. Continue to breathe in and hold your breath for about 10 seconds or for as long as it is comfortable. Breathe out slowly. Now you can shake your inhaler and repeat the steps. Once you've put the cap back on your inhaler, the first thing you're going to want to do is go rinse your mouth out and make sure you spit the water out and don't swallow it. Every time you do a puff, you're going to see the counter on the top of your Symbicort inhaler count down. When you open it, it's going to start at 120 or 60, depending on the size that you're given, and it'll count down each time. When you get down to 20 puffs left, you're going to be in what's called the yellow zone, and that's a great time for you to call your pharmacy and request a refill on your inhaler. That way you can ensure that you don't have to go without a dose of your medicine. You're going to want to dispose of the inhaler once it counts to 0 and gets red, or 3 months after you started using it, whichever comes first. Even though the counter is at 0 and red, it may still feel like there's drug in the inhaler, but if you continue to use it, you will not be getting the correct dose of the medicine, so it's important to dispose of it at that point. You should gently clean the white mouthpiece of your Symbicort inhaler every 7 days. Remove the gray mouthpiece by squeezing gently at both sides, then pulling out. Use a clean, dry cloth to wipe the inside and outside of the white mouthpiece. Once you've finished cleaning, place the cover back on the mouthpiece. Never put your inhaler in water or try to take the inhaler apart. Thanks for watching our video, and we hope that you find it helpful. If you find that you have additional questions, you can always call one of our pharmacies and we'd be happy to help you.